So I had the pleasure of meeting Mr. Schaefer many years ago. We were both actually at a news channel doing interviews for different reasons. And remind me of how I approached you.
Well, we were actually in the green room. The mayor was on ahead of us, and we were waiting. You were there because you had treated one of the anchors. And you were there, and that you were going to be interviewed by the anchor, and you were going to talk about her treatment. I was there to promote the rodeo, to sell tickets. I had had a floor cell treatment from my previous dermatologist, and of course I had a very red face on one side. And I asked the producer, a young lady I knew very well, if they could shoot me from this side, and she said, "Oh, no problem." And you leaned over to me and you said, "Here's my card. There's a better way to do that. And if you ever want to come and see me, call me." I'd been with a dermatologist in the medical center, I guess, for more than 30 years.
Wow.
He decided to stop his practice probably 3 years after you and I met on that show. And I probably went too long, maybe a year, and I suddenly one day said, "I need to see a dermatologist." I dug through my files at the rodeo and found that card. So that's how we got together.
It's just so fortuitous how these things happen, because then that's when we found your spot.
The melanoma, yes.
Right,
yes,
right,
it was.
right.
And I'll never forget, you were looking at me and you said, "Have you ever had any work done up here?" And I said, "Yes, it's been frozen a couple of times, but it's probably been 3 or 4 years since it was frozen." You said, "I really want to take a biopsy of this." And of course, I think it was within 36 or 48 hours, I got that call from you that said, "Here's a number at MD Anderson. You need to go there and make an appointment immediately." And very fortunately, it was caught in time.
Yeah, you know, that's what we keep talking about, is skin cancer is such a preventable illness, and people who are ranchers, people who are golfers, people who grow up outdoors, that cumulative sun exposure, and then with the genetic history too, you're just at such high risk. And if we have a yearly skin exam and you're so smart that you were getting checked, you know, if you catch it early, it's a preventable, beatable illness most of the time. So I'm just glad we caught it early.
Well, absolutely, and of course I'm very glad we caught it early. But as you and I had talked about, I lost my only sibling, my brother, to melanoma 10 years prior to me coming in to see you. A college classmate of mine and someone I grew up with in West Texas was a county agent on the High Plains, died of melanoma 15 years ago. And all three of us came from the same environment out there in that West Texas sun. And I think as we talked earlier, it was real cool then. Unfortunately, I see a lot of young people without hats and without shirts during the summertime. It's still cool to get a tan, not cool.
No, not. And you know, tanning beds too. When I was growing up, we all used tanning beds, and now we know better. It's like smoking, you know, it's something we know adversely affects our health, but people still do it. And really people do, especially I find kids under 18, you know, I try and get them to wear sun shirts and counsel them, but they think it's cooler to get that sun, but I wish they could meet you and so many others, because I think they would go back and change their behavior if they could.
Well, and we're talking about the melanoma right now, but between you, the dermatologist I had for 35 years, and the dermatologist I had for 7 years before that, I think you did 3 spots on me today. I probably had 100 spots on, and it's all an effect of having been in that sun, driving that tractor, getting that tan before the summer pool.
You know, and I'm glad you bring it up this way, because I find, you know, there's so many men out, you know, during the rodeo that are ranchers, and you know, sunscreen isn't that masculine. They don't want to put it on. They want to be in nature. And I think that there's a shift now, and sunscreen's becoming more socially acceptable and covering up. Luckily, y'all wear great hats, but I've really been trying to preach to my ranchers, you know, this is the current wisdom is to wear sunscreen, and it's just silly not to, because it saves your life.
Well, it absolutely does. It not only saves your life, it saves your looks.
It does. It does. It's the best anti-ager there is.
Whether it's cool or not to have sunscreen on, it's really not cool to have those scars.
No, it's not, and it's not fun to go through the surgery. And I always say to my young patients when they come in, I wish they would spend a day seeing patients with me so they could meet, you know, 70-year-old men who I'm freezing actinic keratoses off, that would, you know, absolutely tell them, look, don't do what I did. You know, wear your sunscreen, wear a hat, because Otherwise, you're going to be seeing your dermatologist every few months getting these spots off, and it's just not fun. And when they were growing up, and I'm sure when you were growing up, no one used sunscreen, right?
Didn't even know what it was.
Right, we didn't have the technology. Now we know better, so it's just silly not to use it. So I'm hoping the young women do it because of the cosmetic aspect of it, and the makeup covers it up, but the young men don't. So, you know, anything we can do to inspire young people, especially guys, to wear sunscreen is fabulous. So I'm so grateful for you sharing your story, and it's just been such a nice experience with you, because I know how much it impacted your family and your life going through this, and that you're taking the time to help others is just so incredible.
Well, I can't think of anything more important, you know, and you mentioned smoking earlier. This is just one more preventative thing that you can do throughout your life that will prolong your life, but it'll also be sure that you're around for all those people that care so much for you.
Absolutely. It's not just about you. Like we say, wives save lives. And I know your wife has done such a great job of watching your scalp, what's under that cap, and finding spots early. And that's something, you know, I find so often. I say, tell your hairdresser, tell your spouse to look in your scalp, because that's somewhere you can't watch. Well, thank you so much for sharing your story. It just inspires me so much to try and convey to my male patients that it matters, you know, and to keep pushing them, because some of them are so resistant to sunscreen, and I just wish we could do more to get them in and get them checked. So thank you.
My pleasure.